Hello, my name is Afolake Lamina-Talabi. I'm here to talk to you about a research study on medical error related to the clinical use of medication used by cardiovascular surgery patient before admission to the hospital. This research was conducted in Turkey, a country in the Middle East, on medication error related to the clinical use of medication used by cardiovascular surgery patient before admission to the hospital. The research is a cross-sectional study. The researcher looks at the rates of medication errors and prolonged hospital stay after surgical procedure. Medication error are the most common type of error that has impacts on patients' well-being. According to the researchers, these errors are usually made in medication used by patient before hospitalization. These errors occur mostly during admission, discharge, and transfer of the patient to one clinic to another. The objectives of the study was to investigate medication with error and the presence and the type of this error in medication taking before admission by patient who will have a vascular surgery. The researcher used descriptive and cross-sectional. This study was conducted in a cardiovascular clinic of a university hospital that is located in the west of Turkey. The nurses see their patient at the admission to the clinic. The physicians see their patient and record their medical history. Physician's order is created electronically. The nurse then takes the treatment plan according to the physician order. The mean number of medications used before admission to the hospital was 4. 34.5% of the patient had error in medication used before admission, and the errors in physician order related to omitted medication. The number of medication in which error occur in physician order are 116. That's a lot. Oral anti-diabetic medication and insulins and drugs acting on the cardiovascular system comprises of 25.2% and 32.2% of this medication respectively. Abu Hussein 2011 showed in their study that there was an error in medication of 37% of patients who had been taking this medication regularly before admission to the hospital. The study also revealed that 35% of these errors related to omitted medication. Another 35% was a result of incorrect dosage of medication. According to the report, multi-medication interaction may occur when patients continue to use their medication after admission to hospital without informing healthcare personnel in advance. That means that when patient was admitted to the hospital, they bring along with them their medication from home and they continue using it without the medical personnel knowledge. So this is a serious situation. It's a life-threatening and it can create another problem for the patient. Study revealed that 21.4% of physician orders at the time of admission to hospital was inaccurate, and 53.8% of these inaccurate orders were potentially adverse drug events. That means they can impact the patient indirectly, causing more harm than good. Problem caused by medication error leads to overstay. That means hospital overstay, complication, and extra costs in hospital bills. World Health Organization stated in the year 2007 and 2014 that all medication used by patients needed to be recorded accurately and adequately in order to prevent threatening medication error. Patients of cardiovascular surgery had a higher rates of comorbidity and high use of risk medication. Ethical approval was obtained from the Ethics Committee of the University Hospital. Before data were collected, all patients were informed about the aim of the research. Verbal and written informed consent were obtained from each one of the patients. The study population was formed by patients who were age 18 or older, hospitalized within 24 hours, use medication before admission to the hospital. That means they are using their own medication before hospital admission. They can speak English, they can communicate verbally, they are conscious, And the study population was formed by 113 volunteers who met the criteria for this study. Patient identification form was comprised of 12 questions. This form had questions about patient medication history, how medication were used, continuation of medication, changes in medication before admission, and the reason for discontinuation of the medication. It was investigated that electronic physician order related to the use of medication before hospital admission of 113 patients admitted to cardiovascular clinic. It was observed that medication error between medication taken before admission hospital and medication listed in the physician order of 39 patients. The physician order of 34.5% of patients were error. All of the error that occur in medication used by patient before admission to clinic were omitted medication. In omitted medication, patients continue to take their medication that they used before admission to service, even though this medication were not recorded by the physician. Meaning that patients have this medication, they brought this medication from home, they continue taking it in spite of being seen by the physician, in spite of being given another medication by the physician. They were still using their home medication without the knowledge of the physician and the nurses. Physicians and nurses have the responsibility to carry out treatment successfully. It is important for them to evaluate patients adequately in order to prevent serious problems specifically related to medication. Healthcare personnel should share first and foremost their patient list of medication. They should reconcile the patient medication so that they know what medication the patient is taking. They should identify the contraindication so that they educate the patient on the list of medication they are taking. Medication history should be obtained by using good communication technique, because sometimes when you talk to the patient aggressively, they may not be able to share with you what medication they are taking and why they are taking it. So when you communicate with them in a therapeutic way, they will be able to open up and share with you the medication they are taking. So this will enable the clinicians and the nurses to document and list all the medication the patient is taking so that they can provide them with the right medication while they were in the hospital. My second research study is about the medication error of recent nursing graduate reflection on accuracy of education. This is an online study that includes nursing perception on medication error. The survey includes 168 responders. 55% of them had made medication error. Error that result from inexperience, rushing, technology, staffing, patient acuity. Of all these 55%, 24% did not report their error. Error generally causes emotional distress on the nurses. When an error occurs, blame is often assigned to the individual. That means the nurse that made the error. Error can be a result of interruption, time pressure, staffing, fatigue, or malfunctioning of technology such as computer, infusion pumps, automated medication dispensing machine. Medication error are considered to be human error, such as knowledge deficit, failure to correctly assess the risk of situation. Overall, perception treatment after the error reflected positive environment in some hospital, where nurses were generally treated with respect, fair treatment, and understanding. Most nurses expressed feeling of gratitude that the patient was not harmed after medication error. As for my third research study, I also researched factors affecting the impact of barcode medication administration technology in reducing medication administration error in nurses. Barcode medication administration decreased medication administration error by 50 to 70%. That's a big number. The researcher find indicate that nurses perceive the technology make their job easier, prevent medication error, and promote safety among patients. According to this research, incidence of medication error were reduced by 54% when barcode medication error was introduced. Technology was implemented in 2 cardio telemetric units and the medical surge units. According to the researchers, nursing organizations could also formulate evidence-based practice guidelines to regulate barcode medication administration procedure by nurses. Prior to the implementation of this system, staff nurses should be involved in interdisciplinary collaboration. Periodical monitoring of this system should be carried out for quality assurance and to strengthen the impact of the barcode medication administration system. In conclusion of this TED Talk, having a high number of medication errors was a result of acquiring incomplete and inaccurate medication history from the patient. Physicians and nurses should acquire detailed medication history from patients, and in order to have accurate history, they should obtain information from family members' personal record. Error prevention strategy that will provide adequate and accurate information about patient medication history should be developed by using electronic data record. By using electronic data record, physicians can keep tracks of their patients' medical history, prevent errors, duplication of medication, and also keep patients safe.